Dear students, welcome back. In the previous session, we have discussed about the coupled actions of the PIP and DIP joints regarding extensor mechanism. Now, in this session, we are going to discuss about the role of interossei muscles at MCP and IP joints. We have already discussed about the attachments of the interossei muscles in the previous sessions. So because of this attachments of the interossei, these muscles can be characterized not only as abductors or adductors of the MCP, that is metacarpophalangeal joints, but also as proximal or distal interossei, according to the pattern of attachment. Proximal interossei will have their predominant effect at the MCP alone, while the distal interossei will produce predominant action at the IP joints, and it is also having some effect by the continued action at the MCP joint. Okay, these are the functions of this interossei. All the interossei muscles, both dorsal as well as volar, pass dorsal to the transverse metacarpal ligament. We know that here it is present here, the dorsal to the transverse metacarpal ligament. Okay. And also just volar to the coronal MCP joint axis for flexion and extension. Okay, so flexion is taking place at the coronal axis at the MCP joint. Okay, all the interossei muscles or flexors of the MCP joint. These are the flexors of MCP joint. The ability of the interossei to flex the MCP joint. However, it may vary with MCP joint position and with its proximal versus the distal attachments. Okay. So, the main function at the metacarpophalangeal joint is it acts as an abductors as well as adductors, and also helps in the flexion and extension. Okay, yes. Now we will see the role of this interossei at MCP joint in MCP extension. So this pic shows this MCP extension at this level. So all the MCP joints are extended here. Okay. So what happens when MCP joint is in extension? How the interossei muscle works during MCP extension? Okay. So the momentum of any of the interossei for MCP flexion is so small that little flexion torque is produced. So why? Because if you see the attachments, so all the interossei muscles will pass dorsal to the transverse metacarpal ligament, but just volar to the coronal MCP joint axis. So it is present volar to the MCP joint axis, which helps in flexion. So it is present very nearer to this MCP joint, but volarly. So it causes very small torque is produced in MCP extension. So at that stage, this interossei will produce a little flexion, not as much as, so it produces very little flexion when MCP joint is in extension position. Okay, so however, these muscles have a reasonable momentum for abduction and adduction because the muscles lie much further from the AP axis for MCP joint deviation. So it is, if you see this one, so this is the joint MCP joint. Here you can find the AP axis for MCP joint deviation. So AP axis is present like this for this joint. So AP axis is present. So this AP axis, on this AP axis, these muscles produce joint deviation in the extended position. Why? Because the intraosseous can be effective abductors as well as adductors of the MCP joint without the loss of tension that would occur if the muscles were simultaneously producing MCP flexion. The Interossei with proximal wing tendons are better as MCP joint deviators since they act directly on the proximal phalanx. So the proximal tendons are acting directly at the base of the proximal phalanx. So it mainly helps in deviation. Okay, that is abduction or either adduction. Okay. So since all the Interossei having proximal wing tendons and the volar Interossei, which are MCP adductors, which are having only distal wing tendons. Okay. So MCP abduction is stronger than MCP adduction. The dorsal Interossei also have twice the muscle mass of the volar muscles. Okay. If you see in any progressive ulnar nerve paralysis, the relatively ineffective MCP adduction component of Interossei action is the first to show weakness. Okay, so this is the role of Interossei when the MCP joint is in extension. Okay, now we will see the role of Interossei when the MCP joint is in flexion. Yes, here you can see this MCP joint. Here it is in flexion, MCP joint. So when the MCP joint is in flexion, the action line of the interosseous lies more volarly. So if you can see, these are the interossei muscles. Normally it is present on either side, so it moves volarly. So these two interossei muscles moves volarly when MCP joint is in flexion. So, and also the action lines of these muscles lies more volar to the MCP joint axis than it does in MCP extension. So the action line of the interossei is almost perpendicular to the proximal component here. Okay, that is proximal phalanx in full MCP flexion. So still it is not full MCP flexion. So once it is done, then these interossei muscles action lines are almost perpendicular to the proximal phalanx. Okay. So what happens then? The ability of the interosseous muscles to create an MCP flexion torque increases with the amount of MCP flexion obtained. Once the MCP joint begins flexing, the ability of the interosseous to produce MCP joint is decreased because the muscles are now producing two motions simultaneously. Loss of tension in the interossei through MCP joint deviation is prevented here, because the collateral ligaments of the MCP become increasingly taut. So not only the action of these muscles, but also the collateral ligaments of the MCP joint is becoming taut during the MCP flexion. So the tension in the collaterals gradually diminishes the range of deviation available in the full MCP flexion. So MCP abduction and adduction are completely restricted by these tight collateral ligaments and also by the shape of the condyles of the metacarpal head and by the inability of the interosseous muscle to shorten enough to produce both flexion and deviation. So during MCP flexion, the interosseous mainly helps in the flexion of the proximal phalanx, that is MCP flexion. It also helps in MCP flexion because the action lines are more perpendicular to the proximal phalanx during MCP flexion, whereas at the MCP joint, the ligaments, that is the collateral ligaments and also the bony shapes of this carpals and this phalanges also restricted the deviation movements. So because of that structures around this metacarpophalangeal joint and also the action line of the Interossei muscles mainly helps in the flexion but not the deviation at the MCP joint. Okay, so this is about the role of interosseous during MCP joint extension as well as flexion. Now we will see a role of Interossei at the interphalangeal joints during IP extension. So for this we can see at the extensor mechanism again. Yes. So the ability of the Interossei to produce IP extension is governed by the distal wing tendons of the muscles. So we know that this is the distal interosseous muscles. So this one mainly helps to produce the IP joint extension. To create the tension in the extensor mechanism and extend the IP joints, the muscles must have tendons that attach to the central tendon or lateral bands. All the interossei, both volar as well as dorsal, have distal wing tendons except the first dorsal, that is which is attached to the thumb and the abductor digiti minimi. So all interosseous have distal attachments except the two outside abductors. Okay. So when the MCP joint is extended, the action lines of the distal interossei are ineffective in producing MCP flexion but still capable of extending IP joints. Okay, so proximal interphalangeal joints as well as the distal interphalangeal joints. Since the distal interossei attach directly to the central tendon and the lateral bands, their IP extension action is stronger than their MCP deviation action. So the deviation at the MCP joint is mainly done by the proximal interosseous tendon, but the extension is mainly done by the distal interosseous tendon. So, and also it is also having a minor role in deviation, but the distal interosseous will have a stronger role in the IP extension than the MCP deviation. So when the MCP joint is in flexion, the action lines of the distal interossei migrate volarly but are restricted in their volar excursion by the transverse metacarpal ligament. So, if they come volarly also, the volar movement of this interossei muscles are restricted by the transverse metacarpal ligament. So, we have seen in this, so the interossei muscles will come volarly during MCP flexion, and this movement is restricted by the transverse metacarpal ligament. Okay, so the transverse metacarpal ligament not only prevent the distal interossei from becoming slack through volar migration, but it has a pulley effect on the distal interossei. If you see this, if the transverse metacarpal ligament is not obstructing the volar movement, then what will happen? The interossei will move more volarly. What will happen? So, the tendons which are attached to the lateral bands or central tendon become slack. So, if it is slack, then there is no tension created in the tendons which causes extension. Okay, so that is the thing happened with this transverse metacarpal ligament. Okay, so the IP extensor function of the distal interossei appears to be more effective in MCP flexion than in MCP extension. So the IP extensor function of the distal interossei tendon is more effective in flexion than in the extension. Okay, next. So the index and little fingers. So we have seen the attachments. So the index and little fingers each have only one interossei muscle with a distal wing tendon, that is first volar interossei and fourth volar interossei. Okay, so the first dorsal interosseous and the abductor digiti minimi have proximal wing tendons only. So the first and fourth fingers, therefore, they are weaker in IP extension than or the middle and ring fingers, which each have two interossei with distal attachments. So the middle two fingers, that is middle and ring fingers, will have second and third dorsal interossei and second volar and fourth dorsal interossei respectively. So that means middle and ring fingers will have two interossei muscles with distal attachments. So if you see overall role of this interossei regarding the MCP flexion and IP extension, both proximal and distal interossei contribute to the MCP flexion torque. The proximal components are effective MCP flexors, while the distal components are maximally effective as both MCP flexors and IP extensors. Okay, so the most consistent activity of all the interossei has been seen when the MCPs are being flexed and the IP joints are simultaneously extended. Okay, so and also the another thing you have to consider here is, although the intraosseous are not effective MCP flexors when the MCP joint is in extension. Okay, the intraosseous do appear to serve an important function in MCP extension is MCP abduction and adduction. And also, if you see the simultaneous activity of extensor digitorum and flexor digitorum profundus, that is MCP extension and interphalangeal flexion is required, there is a tendency for the fingers to claw, because for the proximal phalangeal segment may collapse into MCP hypertension as the eyepiece flex. So if this does not happen, means there should be a controlled positioning of the MCP during ED and FDP contraction, requires a balancing MCP flexor force to prevent this exaggerated action of extensor digitorum, and which prevents the collapse of proximal segment is by the passive viscoelastic tension of the interossei muscles. So the passive viscoelastic tension is required to prevent the collapse of the proximal segment. Okay, so these are the role of all these interossei muscles at the MCP as well as the IP joints. In the next session, we will discuss about the lumbrical muscles. Thank you.